So, osteoarthritis and gait analysis in the Rehab Hub in Glasgow. We are the only Glasgow clinic that offers 3D infrared gait analysis. Many of our patients come to us, they have osteoarthritis. So, this particular presentation, we're going to look at specifically knee and hip osteoarthritis and how a gait analysis can help you with the management of this. So, one of the questions that I want to kind of, I suppose, discuss during this presentation is, does running put you at higher risk or can it be cured? So, basically, does running put you at higher risk of getting arthritis, whether it be your knees or your hips, most common places to get arthritis, or not? So, let's start with, what do we actually know about arthritis? So, sometimes you'll hear your doctor, healthcare professional describe arthritis as wear and tear of the joint. It's essentially a chronic condition and it is the most common joint disease that there is. It's classified usually this kind of pain, stiffness, swelling, and reduced function of the joint. And the most common, as we said, joints to be affected by osteoarthritis is the knee and the hip. And according to some study in 2013, it's estimated about 8 million people in the UK have osteoarthritis. However, that is probably an underestimate based on where we are now, nearly 10 years later, and also the fact that we're all getting bigger and obesity is a major risk factor for osteoarthritis. Who's more at risk? Well, if you're over 40, if you're female, genetics, if your parents have had it, if you're overweight, as we said, previous injury, if you've got a job that's really demanding physically, and if you have any other joint diseases, for example, rheumatoid arthritis. So, can running itself cause osteoarthritis? So essentially, we're not going to guess about this. Many people would say absolutely it can. Some people would say absolutely it doesn't. But let's look at what the literature says. And in a study in 2016, it looked at the role of running in the development of knee osteoarthritis. The actual study in that, as we can see here, was inconclusive, but it did report that runners had a 50% reduced likelihood of undergoing surgery due to osteoarthritis compared to the public who were sedentary. So just think about what that's saying. And another study concluded that recreational runners, the key thing to look at here, had a lower incidence of hip and knee osteoarthritis than individuals who were sedentary. So essentially what that's saying is that you are less likely to need surgery or get arthritis if you are a recreational runner over those individuals, members of the public, who are more sedentary in nature. However, what we will see is that arthritis definitely is associated with those who are at the elite and professional level of athletics, however, not for recreational runners. So if you enjoy running and you are, it's a recreational thing, it's something you really enjoy. So that should be a bit of good news to kind of know that the research shows that actually as recreational runners, running does not contribute, is not a risk factor associated with osteoarthritis in the knees or the hip joint. However, as we said, recreational runners have less risk of developing knee or hip osteoarthritis compared to non-runners, sedentary individuals, and competitive athletes. So essentially, competitive athletes are more at risk, and that was a study done in 2017. But so professional runners are more at risk of arthritis. So how do we diagnose arthritis? Many people will say, oh, you have to have an MRI, you have to have an X-ray. Actually, you don't need that to get a diagnosis. If you were seeing if you even got to see an orthopedic surgeon, they literally would just do an inversion test. They would lift your leg up, you lie down the table, lift your leg up and move your hip in a particular way, inversion. And if it basically elicits pain, then that would be a fair indication based on the rest of your clinical history that there is some arthritic pain in there. Usually they will do certainly at least an X-ray, and certainly if you were considering surgery, they would need an X-ray, not for any other reason than the need to actually look at the size of your joint and make sure that um, they can measure it and they know what they're doing. So actually, you don't need to have an MRI to diagnose that, and your physio podiatrist will be more than capable of doing an inversion test and testing out your hips based on your clinical history presentation, and be able to give you that diagnosis without having to subject you to any radiation. So you don't actually need to have scans. Really, you start going for the scans and things when you are maybe you're ruling something else out. If there's some other clinical presentations there that need to be considered, or if you are considering surgery or other maybe invasive things that you want to do, then that would be when you would be looking at getting imaging. Unfortunately, you can't cure it. It isn't curable. There is no cure for osteoarthritis, but there's loads you can do to reduce the pain. Now, I myself, I've had a hip replacement. I used to run the Scottish running team as a professional runner. So I have a new hip. And there are things you can do. It is awful. Arthritis is not fun. So you can do things like, obviously, we saw that being more sedentary actually increases your likelihood of getting arthritis, but it also does not do you any favors when you have it. You need to move as much as you can. So actually regular exercise, strengthening the muscles that need strengthened, and trying to relax some of the muscles that are maybe getting into a spasm as a result of restricted motion. Reducing the amount of load and the stress that's going through the joints. Obviously, weight, if you lose some weight, that will also help. Painkillers, anti-inflammatories, if indicated, if there is an inflammatory process happening, which can happen because of the kind of rubbing and the friction of the joints, you then get this cascade of inflammation. So sometimes you may need things like naproxen, things like that. It just really depends how bad you are. Rehabilitation, physiotherapy, rehab, MSK podiatry are always something that you should be seeking advice from. And there is also injections. So you can get things like steroid injections into the hip and other modalities. But again, that's kind of a wee bit more down the line. But these things are there. How can Run 3D help you? Right. So I kind of said at the start, we offer Run 3D and also Walk 3D. You don't need to be a runner to get this assessment. And essentially it's a way that we can accurately measure how you are walking, how you're moving, how you're ambulating. And it gives us an unbelievable amount of information as to why you're loading your tissues the way you are. It's a lot of the time we are very, as clinicians, great at treating a symptom, but not great at rectifying or getting to the bottom of the cause. Run Walk 3D this is really where it comes into its own. So we can look at the results of this 3D analysis. We are the only clinic in Glasgow. The closest one, there's only two in Scotland. There's one in Perth and us in Glasgow, so at the rehab hub, and we are the only clinics that offer this level of gait assessment. It is the only gait analysis that will be covered by your health insurance. It is the only one that is seen worthwhile doing. If you've been anywhere else and had or thought, or maybe you've been to a shoe shop and been sold some shoes and they've done a scan or something of your feet, that is not anywhere near the level of what we are doing here. This is research standard. The company actually developed Run 3D as an Oxford University spin-out company. We collaborate with some of the Vicon is the motion capture technology cameras. It's the same cameras that capture your big motion films like Star Wars and things. We are putting you into a 3D environment and analysing your movement in 3D. There just isn't anything else like it out there. So if you're wanting accuracy to figure out exactly what's going on, then there is absolutely no comparison. So we look at all these results and it gives us a clear picture of how you're moving and then the factors that are likely to be causing your movement patterns. And that really is Run 3D is data driven. It gives us an immense amount of data on exactly how you're moving, and it enables us to target the areas that absolutely require you. It allows us to give you the best rehabilitation techniques. It lets us know exactly what needs strengthened, what needs lengthened, where the mobility is lacking or where the stability is lacking. If there's stuff going on with your feet, knees, everything that you're doing from your lower limb all the way up to your lower back. If you've got certain gait parameters, so if you need to strengthen particular things, if your range of motion isn't great in a particular area, it shows it out. It shows us exactly how you're loading your joints. And then most importantly, say for example, maybe you've got some arthritis in your knee, or you're getting some pain in your knee, it allows us to prevent that getting any worse. So yeah, it really does allow us to really individualize your treatment programs based on exactly what you're doing. So as we said, there isn't any cure for knee osteoarthritis. However, Run Walk 3D can help deliver an individualised treatment protocol that can absolutely look to decrease the rate of disease progression. So if you don't want this to get any worse and you want to live a kind of fuller, more active life, then absolutely, if you're getting niggles in your body, whether it be your lower back, your hips, your knees, your feet, anywhere around that kind of lower back down, then this is indicated. And you don't need to be a runner. This can be walking as well. It might just be that you're going out hill walking. It might just be that you're walking for a certain period of time and you're getting sore. This is indicated. This will help you. So here we've got, this was developed by the spirit company Run 3D out of Oxford Uni. And this is some of the identified risk factors associated with hip osteoarthritis. And we can see here in that central part, this is the kind of areas that Run 3D will be looking at when you're on the system. So we're looking at how your pelvis is moving. So those kind of, the power plane is basically what we will call like your sagittal plane. So how your pelvis is sitting when you move, how far, so that hip extension as your toe comes off the ground, what your hips doing, how far your hips flex, so that means it's bent, what your knees doing, what your ankles doing, and then we'll also look at the measurements of your control plane. So your control plane is your frontal plane. So where we've got that kind of motion side to side. So you might have heard of things like Trendelenburg type gait. It might not be as obvious as having this massive side motion. You may not see it really just by looking at you, but we can see that when we've got you all marked up in this 3D environment, we can see exactly if there's any weakness there. We can see if there's any kind of over rotation or you're rotating more. And this is really where the 3D system comes in, is one, because we get to measure that transverse plane as well, where we are not just your sagittal, frontal, you're getting that sagittal plane. So it's that 3D environment. There is nothing else that is able to look at those parameters. What's happening at your foot and ankle. Obviously, the amount of load that goes through. So your hips, we've got 2 times, your knees, we've got 4 times, and then by the time you get down to your foot and ankle, you're 6 times the force going through. So it's a really important area with injuries. You might be getting knee problems, might be getting hip problems, and the main cause of that might not be where your hips are. And where the problem is, or where the pain is, I should say, usually isn't where the problem sits. It's usually out with where you're getting pain. So this really gives us an indication of shows you what we're assessing. So if you were coming in with pain or with suspected hip osteoarthritis, or you're worried about hip osteoarthritis, these are the types of things that we can, that if we saw in your walking or your running, if we saw these types of presentations, what we've just discussed there, then this increases your risk of loading your hips. So, for example, having that pelvic tilt at toe off, that's a high anterior pelvic tilt, will increase your risk. So just different things like that. Now, with your 3D assessment, we don't just do your movement assessment, but we also do a full musculoskeletal exam. So you might hear things called MSK. So that just means musculoskeletal. So we'll look at strength, we'll look at flexibility, and we'll actually measure that. We're not just guessing, we're actually measuring your peak force, so how much force you can actually apply, and putting a quantified number on that so that we can accurately measure that and accurately see how you compare, and then link that into the overall presentation with your kinematics and your MSK exam. So it's the most thorough assessment that you're going to get, but the main thing here is that it allows us to look at those risk factors where that leaves you more vulnerable, and then then what do we do about that? So we can give you that rehab program that's specific to what you need. And we can see here some of the knee osteoarthritis risk factors. So if you were in and you were getting, again, that pelvic tilt, you can see that reduced knee flexion, so that reduced knee tilt. So if you've got more of a posterior pelvic tilt, that research shows that actually can increase the load that's going through your knee. If we've got a high knee flexion, so if you're landing and your knee is excessively, so say for example, your knee's meant to bend, right? And sometimes people will think, oh, I've got a sore knee, so I just won't straighten it as much. But actually, if you're walking with a really bent knee, you're actually putting more force through that knee and actually up into your quadriceps as well. So actually you're putting more loads through those tissues and again, putting that more at risk of osteoarthritis into the knee. So so that kind of high knee flexion at foot strike will do that. So differences if you've got a reduced stride length, again, and you've got a widened step width. So if you're very wide, again, puts higher risk. These are factors that we would look at. So what we're able to do with that, so if we see these, so in your analysis that you get, if we find some of these identified risk factors, then what we can do is we know that we can associate that with your clinical presentation and then do something about it. So whether you're running or whether you're walking, once we've got that information and we know that that's a risk factor for you, then we then know what to do with it. Many people will come in to see us because they've maybe got niggles with their lower back, niggles with their hips, niggles with their knees, niggles with their feet. So when we assess that, it then allows us to then look at and go, right, okay, we need to change this, or we need to offload this tissue because this will help us reduce the likelihood of you developing or worsening your disease process from your osteoarthritis. So what happens basically once you've done your gait analysis and your MSK testing with us at our Run 3D clinic, because this is a case study that Run 3D did. So essentially, so this is to give you an idea of what happens during this. So this was a knee case study. So basically they did the walking analysis. It wasn't a walking analysis, and they did a full assessment. So they did the musculoskeletal assessment as well. So you imagine they're all markered up with their Run 3D stuff on. They've done their walking analysis and they're also their MSK. And essentially what was shown was, out of those previous risk factors that I've just shown you, this particular patient had 5 of the 11 risk factors for knee osteoarthritis. And a further 3 of them were shown to be really kind of either up on that kind of borderline of the affected side. So it was really kind of hitting the nail. It was just to show how accurate this system is. In addition, 5 of the 9 MSK assessments, so the strength and flexibility risk factors, indicated that they were 2 and the other one was borderline lower than the affected side. So if these weren't measured, we wouldn't know this, right? We wouldn't know that, there was a particular weakness on a particular side. Some of these kind of things can be quite insidious that you don't know. A lot of the time when we are assessing patients, they're really surprised at certain findings that come out is not what they were expecting. So essentially the results of that assessment with the information that the patient gave and this crib sheet allowed us to basically identify the biomechanical patterns associated with that patient's condition and allow them to get an absolute individual treatment plan. So an example is the reduced range of motion of the quadriceps, so the muscles at the front of your thighs, hamstrings and ankle dorsiflexion. We know that that's all associated with knee osteoarthritis. However, the results of the walking assessment revealed that this patient had good hamstring range of movement, enabling us to eliminate hamstring flexibility from the treatment plan and focus to stay instead on the things that matter. So essentially, a lot of the time you'll maybe go and be analysed or tested, and what was found here was what would normally be given to you in a normal clinical exam wouldn't be the main areas that you'd need to work on. So you'd be wasting your time doing rehabilitation on the stuff that actually you don't need to work on. Does that make sense? So the system allows us to accurately pinpoint where we need to focus down on. It gives us that information. Honestly, it's like an MRI for your body, your movement. Now, we can't cure osteoarthritis, but there is loads that can be done in terms of conservative rehab. So I myself have had to have hip surgery, but not to, I rehabbed all the way through it. I was back at work 3 weeks after actually a full hip replacement. I was ready for it. I was strong. It's a brutal surgery. It's not something I would wish on anybody, but my recovery was great. I've got another patient just now that I'm working in. This particular patient, she is going to need a replacement, but we have managed to keep her off the surgeon's table, pain less pretty much. She's not been on any medication. She's not needed any medication. So that's where we want to be for the last 4 years. So we've managed to just maintain her. Now, we'll just see how that goes. But she's fully aware that the likelihood is that she will end up needing a hip replacement at some point. But so far, 4 years down the line, she's still not on any major painkillers and she's managing fine. And this is just a little bit of proof. So the scientific literature suggests that 11 of the kinematic parameters and the 9 of the strength and flexibility parameters that we measure with Run3D are associated with or commonly seen in patients with knee osteoarthritis. So these are the things that we're measuring. So if you have got or know anybody that has and is struggling with osteoarthritis in the hips and the knees or down the ankle and the feet as well, then this is for them. This is just to give you an example of what our reports look like for us. So when we get this, the results are basically cross-referenced off the report that comes out of Run3D, and then we've got the crib sheets that Oxford Uni that we showed you. If I just jump back to that presentation, so these crib sheets here that the guys at Run3D and Oxford University pulled together for us, and we can see here that the risk factors are absolutely bang up to date and show that the parameters that we're measuring are risk factors associated with osteoarthritis. So Run3D really, if you are in pain, people will often say, SJ, who's this for? Why? What's it going to do for me? If you move, if you walk, not just if you run, and you are experiencing pain in your lower limbs from your watch is good on your lower back down, so lower back, hips, legs, knees, ankles, feet, then this is for you. If you want an accurate assessment and to get to the bottom of what's going on, then book yourself in at the Rehab Hub for a gait analysis with our Run3D system. You will not regret it. The system, when you come in, you are all markered up. You have on like a whole all these markers all around your body. You're in a 3D environment. You're pulled into that 3D environment, and we analyze you, whether you're walking or whether you're running. It doesn't matter, whatever your thing, what you need assessed in, and your full musculoskeletal assessment as well. From there, we then interpret those results. You get a copy of all of that. You get a full report of findings. So if you're working with any other physiotherapist or podiatrist or personal trainer or any other rehab specialist, then we are able to send them and give you your results so that they then know what they're working on you with. If you want us to rehab you, that's also something we can do. But we also provide you with an at-home rehabilitation program that you will be able to do even if you don't come back in and see us or any other healthcare professional again. You will still have, 1, that information, and 2, the appropriate rehabilitation that you need. So I'll just leave it with the references of what was referenced throughout this presentation. If you have any questions, don't hesitate to get in touch. I've put with this video all the details of our Run3D system, how you would book, and maybe we'll get to analyze you and your movement